Hello, everyone. Welcome back to Beyond Breathing, the podcast for everyone who breathes and sleeps. I'm your host, Lancette, and I want to thank Sierra Sleep, Airway, and Wellness Center for sponsoring this episode. And today we're diving into something I'm seeing constantly in clinical practice, in airway care, in dentistry, and in medicine, and honestly, just everyday conversations, and that's wearables. Sleep trackers, wearables like Oura Rings, Whoop, Apple Watch, and so many more. Remote patient monitoring. And something I really wanted to highlight today, a new term that I came across, but I'm seeing this in my family, my friends, and my patients, and that is orthosomnia. What that basically means is that we are trying so hard to achieve perfect sleep that we're actually making our sleep worse. And if you've ever checked your sleep score before you even got out of bed, you're definitely not alone. Today's episode is all about sleep tracking and when it helps and when it hurts. Orthosomnia was first described by sleep researchers to explain a growing phenomenon, people becoming fixated on sleep data from wearable devices instead of focusing on how they actually feel. But here's the irony, sometimes the pursuit of perfect sleep metrics actually increases anxiety, hypervigilance, insomnia behaviors, distrust of your body's natural signals. I honestly have had my patients say, my watch says that I slept terribly, but I actually feel fine, or vice versa, or the opposite. My numbers look good, but I'm exhausted. And that disconnect is very concerning to me. And that disconnect matters because sleep isn't just data or a number or a score on a watch. It is our body systems. It is physiology. Now, when we talk about wearables, I want to be really clear. They are really helpful. I am very pro technology. Wearables have brought incredible awareness to health, like heart rate variability trends and oxygen saturation patterns, movement during sleep, sleep physiology, behavioral awareness, and remote patient monitoring is changing healthcare by improving all kinds of metrics across health, improving chronic disease management, supporting treatment compliance, increasing patient engagement, getting people involved in their care and allowing for earlier intervention. And in airway and sleep medicine, this awareness can literally save people's lives and lead to earlier evaluations for conditions like sleep apnea. So wearables and sleep tracking brings a lot of patients to my practice. And that's a good thing. But consumer sleep data has limits, and most wearables estimate sleep by using movement, heart rate, temperature, algorithms, and they do not measure brain waves like a sleep study. So they are screening tools. Wearables are not diagnostic tools. And when patients treat these sleep scores as the absolute truth, that's, I think, when problems can potentially start. The wearable trend is not new, it's not going away, and it has become an obsession. And let's talk a little bit more honestly about this. Is checking sleep scores before checking in with your body should not be our daily practice. We should wake up and listen to our body. Are we relying on caffeine? Are we relying on aids to help us sleep? Are we relying on aids to get through the day? That is way more important than your sleep score. And many people today are modifying behavior solely to just improve a number or a metric, not to actually improve how they feel or the quality of their life. Many people today feel anxious when the numbers drop or aren't as high as they want them to be. They trust the devices more than they're trusting their symptoms. That's orthosomnia in action. And clinically, I encourage patients to notice your energy levels. What is your focus like? What is your mood like? What's your breathing quality? What's your daytime function looking like? What's your stress resilience? Because those are the scores you should be listening to. Your body should still be your primary data source, not a watch or not a ring. These devices just give us additional clues and support how our mental and physical health actually feels. And signs and symptoms of sleep apnea should be on the forefront for all of us because it's so common. And I want to talk about some signs and symptoms of sleep apnea for our medical and dental providers out there and some things that we should watch for. And medical dental collaboration is essential when it comes to sleep apnea and disordered breathing. All medical and dental providers should be asking their patients if they snore, if they mouth breathe, if they grind or clench their teeth, or has somebody witnessed you having apnea or said that you gasp or choke while you're sleeping? Do you have restless sleep? Do you have frequent awakenings or brain arousals? Do you wake up in the morning with a dry mouth? Do you have to get up in the middle of the night to use the bathroom? Do you have daytime signs like fatigue, waking up tired, or relying on things to get through your day like caffeine or coffee? Do you have morning headaches, brain fog, mood instability? Elevated blood pressure is a huge red flag that there might be untreated obstructive sleep apnea. Are you having issues with acid reflux or insulin resistance? And then in the mouth, especially for those in the dental setting, some huge red flags that you should be talking to your patients about, assessing every patient every time, regardless of age, is there scalloping on the tongue? Is there a small mouth, a narrow palate, a retrognathic profile or a small mandible, malocclusion? Is there inflammation in the airway, like enlarged tonsils, elongated or red uvula? Do your patients have a hard time breathing through their nose? And I want to be clear for all medical and dental providers out there that snoring is not harmless. It is airway turbulence. It is often the number one red flag we're going to see with untreated sleep apnea. And mouth breathing is way more serious than I think most people realize. Chronic mouth breathing increases the risk of getting cavities, gum disease, altered craniofacial development in kids, meaning crowded teeth, reduced nitric oxide production, which is our miracle molecule to help keep our blood vessels open. Mouth breathing leads to poor sleep quality, systemic inflammation, yet culturally, we normalize it. We joke about mouth breathing, we joke about snoring. We ignore fatigue, and that delays diagnosis. And I want to add something also that I'm seeing with my patients is that new cosmetic procedures like Botox and fillers are now masking dysfunction. This one requires sensitivity, but also honesty. Sometimes cosmetic interventions address symptoms without addressing underlying dysfunction. So examples include doing Botox for bruxism without an airway evaluation or sleep study first, because that often is the root cause of bruxism. Cosmetic dentistry without looking at sleep assessments and occlusal function. Fillers or facial aesthetics without functional screening. Fillers and facial aesthetics making it more difficult for people to control their nasal breathing or to obtain a really great lip seal to encourage nasal breathing. And orthodontic relapse is also linked to airway instability. There's nothing wrong with cosmetic hair like braces, but functional assessments and sleep studies should come first. They should become any Botox or fillers or Botox for TMJ issues or orthodontics, because airway health affects everything else. And we have a huge cultural problem right now. Bad sleep as a badge of honor. I think this might actually be the biggest issue that I see is we've normalized chronic stress, overworking, sleep deprivation, high caffeine resilience. That hustle and bustle culture often celebrates exhaustion, but physiologically, sleep deprivation contributes to heart disease, metabolic dysfunction, mood disorders, cognitive decline, immune system dysregulation. Sleep isn't optional. It is maintenance. It is how our body is able to perform. And we have a lot of opportunity for wearables, data tracking, and remote patient monitoring. The pros of this remote monitoring that we have now is that we get a lot of data in real time besides snapshots, waiting for that once a year doctor's visit. We can have the opportunity to have an earlier detection of issues, maybe before there is a big problem. We know that people are more likely to get involved in their care when they can be engaged through wearables. We can also change habits. And I really do think that wearables have the opportunity to help reduce healthcare costs as well. But they carry a price tag, and that can be obsession, orthosomnia, obsessed with our devices, that we listen to the devices, and we're so focused on a score rather than how we feel, which can lead to increased anxiety. Making sure that the data is accurate that we're getting from devices. There might be future concerns about privacy concerns, health equity challenges that only people who have a lot of money can afford the luxuries of some of these wearables, where maybe mainstream Americans can't afford them. Maybe an over-reliance on technology and less reliance on experts in healthcare. So technology should enhance clinical care and not replace it, and it should be available for everybody. And the clinical sweet spot is the best outcomes happen when we can combine wearables and awareness around health metrics, clinical evaluations with experts, airway assessments with FDA cleared sleep studies, behavioral coaching, and interprofessional collaboration, medical and dental experts coming together. This is where prevention really lives. Dental hygienists, dentists, sleep specialists, physicians, ENTs, child psychologists, etc. We all have a very valuable role and need to work together. My clinical message that I tell my patients is use wearables, a ring, a watch as a compass, not a report card, and maybe not a valid whole picture of what's going on with health. Look for patterns, not perfection. If something feels off, get evaluated. Trust your body more than the numbers. Sleep is biology, it's not a performance. And technology is advancing fast. Wearables, watches, rings, remote monitoring, AI-driven health insights, they're here to stay and it's exciting. But human clinical insight still matters. Listening to the body still matters. And prioritizing sleep, that might be one of the most powerful health decisions anyone can make. If this resonated with you, please share it. Share it with somebody who's tracking their sleep. And if you're seeing signs of airway issues in the medical or dental world, or sleep disruption, or teeth grinding, or snoring, please, please, please refer your patients for a sleep study. If you are somebody who is feeling fatigued, relying on caffeine, never feeling quite rested, please seek professional evaluation for yourself too. You deserve restful sleep and better breathing. Until next time, breathe well, sleep well, and live well.